Welcome back to Midday. Time now 11:23, and the holiday is not stopping people from getting the COVID-19 vaccine. The state of Texas is still in its first phase of administering the shots, and that means healthcare workers, some first responders, and people living in long-term nursing or assisted living places are getting their first doses. According to the latest data available from the state health department, nearly 84,000 people have received their first of 2 shots. About 5,400 of those people are here in Travis County. And it'll be a few months before many of us can get our turn for the vaccine. This week, though, the American College of Obstetricians and Gynecologists changed its guidelines recommending pregnant women for the vaccine. Joining us now is Dr. Shahryar Kavusi. He is a reproductive endocrinologist at the St. David South Austin Medical Center. Good morning, doctor. Thank you for joining us.
Good morning, Bryce. Thank you for having me. Appreciate you.
So first of all, neither Pfizer or Moderna tested the vaccine on pregnant women during their trials. So can you help explain to us why it's now being recommended?
Yes. So I think, the first thing to do is look at the background in the scenario here. The absolute number of women that have severe COVID-19 who are pregnant women who get severe COVID-19, the absolute numbers are pretty low. But those women actually are higher risk for having more severe illness, basically, than non-pregnant potentially. I mean, actually, when you think about non-pregnant versus pregnant women who are symptomatic with COVID-19 have a higher chance of getting severe illness, which means they could be in ICU or have mechanical ventilation. So again, the absolute numbers are low in pregnant women that are symptomatic. However, they can get sick. So the COVID-19 vaccine now is being distributed to people that are 16 years or greater in age. And the American College of OB/GYN, obstetrician gynecologists, and the American Society for Reproductive Medicine have these guidelines right now, recommendations that we are not to withhold this vaccination, either of the two that are available right now, from patients that are wanting to get pregnant, that are pregnant, or that are lactating. And to expand on it a little bit more, it's because the mechanism of action of these vaccines, these mRNA or messenger ribonucleic acid vaccines, does not lend to getting in the nucleus and causing genetic changes. Also, when you think about it, these patients basically, when you think about the vaccine itself, it's not a live virus vaccine, so they can't be affected by a live virus because it's not a live virus vaccine, if you think about that. And there are animal data that have shown relatively reassuring data when it comes to either of the 2 vaccines that are currently available.
So what about side effects? We've obviously heard that there might be some, but are those any different if a woman is pregnant?
So we don't have data on it. So there's basically not available is the data for pregnant women basically at this point. So side effect wise, we'll have to look at that as we go along, of course. But again, because of the side effect profile in non-pregnants and also the mechanism that I just told you all about, we don't feel like it's going to be any worse. But again, we have to wait for data to be published.
All right, and before we let you go, some kids as young as 12 were included in trials, but not many younger than that. The Pfizer vaccine is recommended for anyone 16 or older. So what is the recommendation for babies or toddlers?
Well, at this point right now, we just need more data. So they're going kind of like stepwise to, I believe 12 to 15-year-olds in the studies right now, and then at some point it would be younger people that, the children and toddlers potentially later on. But at this point, there's no data on it at all. So at this point, because of immune systems not being kicked in as well, I mean, it's one of these things where I would just wait on data when it comes to that. But again, the idea behind women who are trying to get pregnant, are pregnant or are lactating, it's to make a shared decision with their health provider. That's what their emergency use authorization, basically through the FDA, suggests to do when it comes to EUAs. So that's the best thing to do right now is talk to your doctor and make a shared informed decision with the patient. Of course, that's what the doctor does, what the healthcare provider does. And that's what we're here to do, is try to help our patients. And again, not to withhold the COVID-19 vaccine from our pregnant, lactating, or trying to get pregnant patients.
All right, well, Dr. Shahryar Kavusi, I'm sorry. Thank you so much for taking the time and talking with us about this today. Again, from St. David South Austin Medical Center. Thank you.
Thank you very much. Appreciate you.